ENT is a specialty. It's a subspecialty. It's actually primarily a surgical subspecialty, but because there's a lot of ENT problems in primary care, we do see a lot of general medical things that we treat. We don't take the place of a primary care doctor really in any way. The patients that I see that have recurrent ear infections, they've all been treated by their pediatrician or their family practice doctor, and then after they get a number of them, then they come see me. Sometimes people do jump over their primary care doctor. Sometimes it's with good reason and sometimes it's not. On occasion, you'll have a primary care doctor who just isn't keeping track. You know, the parent knows that this kid has an ear infection all the time, but you know that pediatrician may see 10 ear infections that day and hasn't really done a log of that particular child. It's his fourth one kind of thing. So sometimes the parent is frustrated that they aren't being sent and they'll just hop right over them and come see me. That's not that common. The pediatricians are really very good about keeping track of that. There are other conditions where we'll see the person first sometimes, and usually those patient-generated referrals, like they're bringing themselves in, they can be a variety of things. Sometimes there's something very serious, you know. Sometimes a non-referred tongue cancer will walk into your office and they'll have a big, you know, sore ulcer on their tongue and it looks terrible, and it's just been there for a while and they haven't really seen anybody. So you do sometimes see people right off the bat, but most of the time they're referred by either a pediatrician if it's a little kid problem, or by their family doctor. I would say the most common things that come to our office are things that we need to do for patients or that we need to do a special assessment for. So they're usually surgical consults. Is it time for my child to have ear tubes? Is it time for my child to have tonsils or adenoids removed? Whether that's for obstructive sleep apnea or recurrent infection, you know, recurrent strep throats and that kind of thing. I have a thyroid nodule, and is it something I need removed or not? My voice has been bad for quite a while, and I need a scope, and so we do flexible laryngoscopy in the office, so we take a scope and look down at someone's airway for various reasons. So if they need sort of a special exam, whether that's a hearing test, ear cleaning and then a hearing test, or that they need to have their history reviewed to see if they need surgery, those are sort of the reasons that people would come see an ear, nose, and throat doctor, is that they have kind of gone to the limits of what their primary care doctor can do for them.